And welcome to the Kahnawake COVID-19 Task Force Daily Update. I'm Joe Delarone, and today we have another busy program as we try to keep you up to date on everything that is happening regarding COVID-19 here in the community. Lots to get to, so we're going to start right away with Ietsenhaienhs Gina, who is going to talk about some of the initiatives in terms of assistance for businesses. So there's some news today on that, and with that we'd like to welcome Ietsenhaienhs.
Just to clarify, it's about client-based services. The business side of it, we do have a press release that came out. The press release today is to inform people that we have 700 applicants. So they have assembled a team that will be working on each application. The applications will be screened and you will be receiving calls this week. You will also receive calls throughout the weekend. The team has decided to work through the weekend because of the large number of applicants. If you are out of work due to COVID-19, some of the areas that you may be eligible for are the COVID-19 Kahnawake Benefit Fund, the Social Assistance Fund, the Employment Insurance, and the Canada Emergency Response Benefit paid through Canada Revenue Agency. So when you get a call from the individuals, we are asking that you have all your information on hand to supply them, as well as trying to get your direct deposit information for your bank account. Checks are going to be mailed out next week, but it's preferred that people have direct deposit. So if you have access to that information, gather that information now. As I said, they will be calling throughout the weekend, so expect that. We have a time frame from 8:30 a.m. to 8:30 p.m. So it's not your average day. You may get a call that will be relatively late in the evening. And again, the relief payments are expected to start as early as next week. So that's just a bit of update on the funding. Nyawagoa.
All right, now Gina, and if you haven't seen the press release, you know, you'll just check it out. It's everywhere, and there's lots more news to come in the following days. Also up for the first time on this on the update is Cheryl Zachary. She's the manager of support services over at Ietsenhaienhs Community Services, and she's going to talk about some of the services that are available to those who may need it at this very stressful time. Cheryl.
Good afternoon, everybody. Thank you for having me here. I just wanted to give an update on psychosocial services that are available in the community and that have become available as a result of the situation that we're in with the pandemic right now. So before I get to that, though, I just wanted to say I know that the month of March, happy April, everybody. I know the month of March has been pretty significant in this community. I know that every day, sometimes every hour, there have been changes, new rules, new procedures. There's been constant information everywhere that you looked. And I know that hasn't been easy for people. So I just wanted to thank everybody who's been involved in supporting the efforts to keep our community safe, because it's been a lot of work. Okay, so nyawa to everybody for that. We're currently in uncharted waters trying to navigate this pandemic. And the uncertainty of this time brings about a lot of fear and anxiety because of the unknown. We don't know where things are headed at this point. The amount of time we're spending without contact with our friends, without contact with our loved ones, can cause a lot of stress for us, but can also bring up different emotions for each of us. It's important to recognize that these feelings are completely normal. Everybody's going to go through them. The reason we're so affected by it is because the social safety net that we've had all along, the one that we've known, all of the tools that we've had, has kind of fallen out between us, has fallen out from beneath us, and now we're trying to figure out what kind of tools and resources are out there to make us feel safe again. The thing is, we can't turn to our neighbor or turn to our friends and go out to dinner or do the things we always like to do. So we have to figure out ways to do that. The thing is, many of us will adapt very easily. Others will need some help to do that. So it's important during this time to create a new sense of normal during the pandemic, to find new tools, to find new resources to keep us in a good frame of mind. I just wanted to give a shout out to the community because I think it's great how the community has come together on Facebook and has developed pages where the community, where community members can connect. Scary Stories Kahnawake, love that one. Tune in to that one, read it at night. Kahnawake local sports stories, the Kahnawake quarantine talent, all of these are great ways to connect. Continue doing those things, continue checking in on each other, and please, if you need support, please reach out to somebody. In terms of the services that are offered at KSCS, we've put a number of things in place so that we can help people to connect with others and to talk about some of the things that they're facing. Our regular services remain available. So we're talking about intake services, mental health counseling, psychological services, addictions response services, youth protection, foster care. Our after-hours response workers are still out there working after hours. We have parenting and traditional support counseling. In addition, our prevention staff are working with us and putting out resources, information, and positive messages out to the community. You can find those resources and information on the KSCS Kahnawake Facebook page, but also on the website at KSCS.ca. At this point, internally, we're working with a reduced staff in the office, but others are working from home and continue to provide services to their clientele by telephone and by teleconferencing. There are no in-person sessions that are taking place unless absolutely urgent and or necessary. So in situations where a client requires intensive support. For these situations, we've designated a specific room that's used. It allows for social distancing, but it's also disinfected after each use. So we want to make sure that everybody who absolutely has to meet in person is able to stay safe. Clients, just so everybody knows, when a client absolutely must come into the office, they are asked the COVID-19 screening questions prior to coming. So that's really important that you not come to the office before having spoken to somebody on the phone. Some additional things that have been put into place as a direct result of the pandemic include a psychosocial support to frontline healthcare and essential service workers. So that's essentially a virtual talking circle with Dr. Joe Beltempo. And that's going to be done on an as-needed basis. I know there's 2 time frames where that will take place. So I'll tell you later on how you can go about getting into those services. The next one that we're looking at, and it hasn't been solidified yet, but it's a radio talk show. We're currently in the process of exploring the possibility of doing a noon-hour talk show to talk about mental health and coping strategies during this time. So we'll have more information to come as the days go on. We're also collaborating with KMHC. So we have given them pamphlets to hand out to those people who are undergoing testing at the COVID-19 testing site. So if you are undergoing testing, you will be asked the question about whether or not you would like to receive any kind of follow-up. If you say yes, then your name will be forwarded to us and we will be contacting you to follow up. In addition, our Let's Talk counseling session, it was once known as the walk-in counseling. At this point, we can't walk in, but we can definitely call in. That's a one-time session, and it's now been extended from Monday through Thursday from 5 to 8 p.m. And the way that you would get that, since it's an after-hours service, is that you would call in through the Peacekeepers and ask to speak to the after-hours response worker, and the Peacekeepers number is 450-632-6505, and again, you would ask to speak to the after-hours response worker, and they will link you up with the mental health support counselor who is on duty that night. We also do have access to a community elder. Those would be online sessions as well, and those would be by appointment only. We have traditional counselors who are able to arrange virtual talking sessions based on need. And finally, we have the tea time, me time from the parenting workers at the Family and Wellness Center. In addition, one last thing, they also have the virtual coffee time with parenting workers, and this helps parents, you know, to look at their own wellness, to get some support, and to get some stress management strategies. So that takes place Mondays, Wednesdays, and Fridays from 10 until noon. So in order to access any of these services, we like to give you the information that intake is the point of contact for anything. So the intake workers work really hard every day to take all of your information and to make sure you're getting all of the information that you need, and that your information needs to go where or to the service that can help you most. So in order to do that, during office hours, Monday to Friday, 8:30 to 4:30 p.m., what you would do is you would contact KSCS at 450-632-6880 and ask for the intake worker, or you could email intake@kscskahnawake.ca, and they will respond to your questions, your inquiries, or anything like that. After hours and on weekends, any services can be accessed by calling the Peacekeepers at 450-632-6505. At that point, you would request to speak to an after-hours response worker, and you will be asked for a callback number, and they will call you back as soon as they possibly can. All I wanted to say is please do not come into the KSCS offices at this point. Please call ahead so we can do the screening and make sure that everything is safe. People will help you no matter what your questions are or your needs for service are, and we're happy to do that. The best way to do that, again, I'm just going to reiterate, is to contact intake at KSCS to get your needs met for services. Thank you.
Now we'll go with Cheryl, and as you can see, based on yesterday's and today's updates, that the good folks over at KSCS have been very, very busy. Speaking of very, very busy, Lisa Westaway joins us once again. She is the Executive Director at the Kahnawake Memorial Hospital Center. She's also the spokesperson for the KMHC. Cheryl. Okay, Lisa.
Hi, good afternoon. So I want to talk a little bit again about the test center. So we've been given the okay to open the test center tomorrow. So we have 24 spots available for testing. I just want to remind you about the criteria. So the criteria for testing at this point, as of actually March 30th, is fever and or cough and or respiratory difficulties and or loss of taste or loss of smell. So you should have one of those criteria coupled with either contact with a person who is positive or a suspect case, or contact with somebody who had traveled in the last 14 days, or actually what's added is contact with somebody who has been to an emergency room in the last 14 days, or working, if you work in the healthcare system, or you are living in a residence. So we're going to put this online. We just got this information. It's as of the 30th of March, but we received it just yesterday, late yesterday. But I would, you know, if it's complicated, I would suggest that you just call our number at KMHC and you book an appointment. We're not sure at what point we may have to close the testing center or and then reopen again. We don't have very clear guidelines regarding this at this point, but what we do know is that we're open tomorrow. So I'm going to urge you again, if you have symptoms, that you call us and that you get tested. Again, the importance of doing that is that it gives us an idea of what's happening in our community. It allows us to make decisions that allow us to contain the virus as much as possible. And we know that the efforts that we've made up till now have been working. So I still today received some results. Again, I don't have all of the full picture, but I have not received any positive results in the last few days. So there have not been any new positive cases in quite a while. It means that the efforts we're making are making a difference, because we are seeing numbers continue to increase around us, and that means that we're working really hard, and we need to continue. We cannot let up, because as soon as we do, we will see cases increase. One thing that the testing site asked me to remind you of is to not call, when you do call to make an appointment, you're actually calling to speak to administrative agents, to home health care workers, to community health workers, dental hygienists. So you're not actually calling to speak to nurses. So we've reoriented people from different jobs to actually work at the testing site. So thank you to all of those who are doing that. But they're not there to answer your medical questions regarding COVID-19. So for that, we ask you to still contact 811. They will tell you, they will do an assessment with you. They're trained for this, and they have all of the guidelines and recommendations from the ministry and from public health. So they'll go through the process with you about whether you should or should not be tested if you're having questions about that. And if they say that yes, you should be tested, then you can hang up and call our number and get an appointment. If you already fit the criteria, then we just urge you to call us and we'll give you an appointment. Right now, there seems to be a lot of uncertainty regarding allergies versus COVID-19 symptoms. So we're going to ask Dr. Gauthier to talk about that on Friday. The main difference that we're seeing between the two is the absence or not of fever. So fever doesn't usually accompany allergy symptoms, but it often does accompany COVID-19 symptoms. But not everybody who has COVID-19 symptoms has a fever. So it makes it very difficult to discern between the two. So we hope that Dr. Gauthier will be able to give us a little bit more information about that on Friday. Nevertheless, if you're having those symptoms and you've had contact with someone, or you've traveled, or you meet some of those other criteria, that's a good indication for us that you could possibly have COVID-19 and that you could be tested. So we urge you to call in those circumstances. One thing that I wanted to talk about is to really just commend the hard work that everybody has been doing. So in my communications with public health yesterday, Public Health Montérégie, they were very, very, they really wanted to congratulate us, the community, for all the hard work that we've been doing. And actually their exact words were, and all other communities could only dream of doing what you're doing in Kahnawake. So she was talking to me, but she wasn't just talking to me. She was talking to all of us. Those who are working, those who are at home taking care of those who are working, those who are self-isolating when they're supposed to, those who are practicing physical distancing, those who are practicing all of their hygiene measures. All of the things that we are all doing are contributing to the successes that we're having. So this is a thank you and a commendation. I don't even know if that's a word, but we'd like to commend everybody, the whole community as a whole. And for those who still think that this is not serious, I really urge you to look around, to watch the news, and to get with the picture, because most of us are following through on what we need to do, and it's making a difference. And we need to continue. You can't let up. We need to keep going. So I just wanted to say a big thank you, because when you guys are following the measures that we're implementing, you're really making our job a lot easier. So please keep that up. Thank you.
Thank you, Lisa. And probably a few people saw some of the posts out there. Paul Grafe, our good friend at K1037, put a post out yesterday. He was right downtown, just took a picture, and the street behind him was completely empty. And that was just something that I never thought I'd see in my lifetime. So it is, as Lisa said, extremely serious. We're out here every day, you know, bringing updates, and hopefully our updates will keep us, will be kind of like the way we're doing, keeping things under control and not getting out of hand. And it is very important that everybody do as much as they can to just keep things quiet and follow the rules. Finally, our final speaker today is the person who's been here doing the hardest work, I think, Lloyd Phillips. Lloyd is the Commissioner of Public Safety, and he gives his update for the first day of April, 2020. Lloyd?
Thank you, Joe. Thank you to Cheryl and to Lisa and Gina for coming in. What we're trying to do as well is, rather than just hearing from Lisa and myself every day, we want to spread it out a bit and to show that there is so much other things happening in the community that are directly related to the task force, a directive, or are supporting mechanisms, to the community. So I think it's important for people to get a full picture of happening community-wide. So that's why we're going to be bringing in more and more people who are working for the community in different capacities, just to give you a brief updates on what they're doing and how they're contributing to this crisis. And we're back. Sorry about that. Some, I guess, technical difficulties, and we have quite an operation happening here behind the scenes, and a lot of switchboards and different things. So unfortunately, sometimes we have a little difficulties. In this case, something very simple as a dead battery. Took us off the air for a few seconds there. So my apologies for that. No, again, like I was mentioning, much like Lisa had mentioned, that she got a call from Public Health and giving compliments to our community, for the work that we're doing. I also had some of the contacts that we maintain contacts with various other First Nations. We keep contacts with government officials, both federal and provincial, municipal, to the extent possible, just to see what's happening and get a picture of what's happening throughout the First Nations territories, as well as across the province. And they echoed some very similar comments of that. They're very envious of how we are coming together as a community and moving forward and during this hard time that we're going through. Kahnawake, we're very fortunate. Again, like I keep mentioning, that community spirit, it's alive and well. It's certainly something that we draw on every day to get us through one day to the next. We're very fortunate as a community. We're very close to a lot of the essential services that we require. Obviously, right here in Kahnawake, we got Kahnawake Hospital for our inpatient department, but you also have access to doctors. So that's obviously a very good benefit to our community. But if somebody needs advanced care, we're not very far from other major hospitals within Montreal region that we could draw upon. So again, we're very fortunate in that sense. The essential supplies. Fuel is close by. We can get fuel into the community. Essential supplies, medical supplies, food supplies. All these are fairly close to us. Right now, obviously, some of the medical supply lines are strained, but for food services and such, they're close by, and we're lucky we're able to get those into the community. And the task force, and along with other business people in the community, are working very hard to ensure that those supply lines are maintained and upkeep is done, so that we don't jeopardize those in any way. Because again, like we talked about yesterday, we are in this for a long period of time. So a lot of work happening on that side as well to ensure that a proper supply of all essential goods are here in the community. Now, maybe just another note that I want to relay, and Dwayne's not here today, Dwayne Zacharie, Chief Peacekeeper, but just to let people know, the peacekeepers are being much more vigilant, in and around the community. If somebody doesn't have a purpose of being inside Kahnawake, if you don't work here, or if you're not here for any purpose, specific purpose, you are subject to be stopped by the peacekeepers, and if you have no reason to be in here, you will be asked to leave. Again, we're trying our best to ensure that our community is safe, and they're doing their part, and I think it's working very well. On a different note, just so you're aware, K103 had spoken to the task force last week, and they had expressed some concerns about their situation. As we all know, in Kahnawake, they rely heavily on radio bingo, which has been temporarily suspended. But with the support of the task force and sent over to the MCK, they are going to be getting financial assistance to ensure that that essential service for our community will be maintained throughout this crisis and beyond, until they're able to get back on their feet once radio bingo does resume. Maybe on a couple of final notes, what I want to talk about again is some numbers. The numbers in Quebec continue to rise, 4,611 last count, which again we're still on that steep curve of having 400 to 500 new cases per day added to the positive cases. But like I said yesterday, there is also the prediction, which was made by a lot of public health people, that we're still below that. So that tells us again, like, some of the measures being taken are starting to work. They are showing some positive movement there, because even at this point they estimated that approximately 17% of all people infected would end up in the hospital. At this point, it's only about 7%. So again, hopefully we're going to stay on that trend. And we'll get through this much easier than people anticipated. But again, like I said before, this is certainly no time to let our foot off the gas, because what's happening throughout the area is having some impacts. But like I said yesterday, and I'll repeat it again, it's going to take about 2 weeks before we're able to have a good solid estimate of when we're going to reach that peak and when we can start seeing some changing of that curve, which I'm going to talk about in a minute, because we had a couple of comments being made via Facebook and some information that we had. People were saying, well, I'm not really sure and clear what you mean by this flattening the curve and all these curves that we're hearing about. And I know it could be a little bit confusing, and so I'm going to attempt to try to make it a little clearer to you, and in simple as possible way as I possibly can. So what I'll do is show you 3 different graphs, which represent different levels of measures being taken to assist in slowing down the rate of spread. First of all, let me just take this for a second here. If you take this cup of water, which is empty, by the way, but if this represents all the people in Kahnawake who will get infected by COVID-19. We don't have very much control on how many people will get infected. That's something that is nationwide, worldwide. You can't really affect how many people will get it. But what you can impact is how fast people get, how fast that spread happens, how fast that spread takes place. So if this was a cup of water, representing all the people who are gonna get sick, and if I would take this cup of water, if you can imagine, and if I would dump it out, that would create a big mess right here on everything, and it would be all over. It'd be uncontrolled. It would spill onto the floor and such, right? So if I look at the first graph, which represents that, you could see that the first graph has a very steep angle. It reaches the top really quick, and then it falls. It's almost like like you see in a roller coaster. And that green line that you see going across there, that represents, the capacity of the healthcare system. Those are all the hospital beds that are available in the area, ICU beds to take care of the people who are very sick. But it also represents, the essential services in the community. So if all the essential service people, whether it be fire, ambulance, hospital, doctors, people providing basic, services to the community, if everybody got sick at once, then we wouldn't be able to function as a community, and we'd be struggling to provide the basic services. So if that line represents the essential services in the healthcare system, you see the steep incline on there. A lot of people would be impacted in a short period of time causing the healthcare system to potentially collapse and cause our community a lot of heartache because the essential services will not be able to be provided to our community. So now, if I take my cup again and I look at it, all right, here I have the same cup, same amount of people in this cup, but if I pour it, you know, a little bit slower, but I still pour it out, right? I'll still create a mess. You know, I'll still be the same amount on there, but it'd be dragged out over a little bit longer time, be a little more manageable, and that would represent us taking some measures. If you recall some of the first measures that we had taken, such as closing schools, you know, stopping large gatherings, no, and limiting access to only essential services, and that helps spread that time frame out. And you'll see on the graphic, you know, again, same amount of people getting sick, but it starts to spread it out a little more. So where that green line is, you see there's less people above it. So the systems are able to adapt much more easily, but there's still that area that people there's way too many people who are sick, and the essential services can still be impacted greatly. So now, well, final graph I want to show you. If I take that same cup of water again, and I just pour it, you know, real slow, you know, I'll tilt it, I keep tilting it, and here as the water's coming out, it spreads out, same amount of people, but again, at that time, I'm able to clean it up, I'm able to manage it. You know, I could wipe it up almost as fast as it's being poured out. So that would represent taking a lot of the strong measures in which we had done, including closing the schools, you know, smaller groups, you know, social isolation or isolation of the sick people, quarantining those who we have to do, you know, staying home, you know, the physical distancing, all these measures that we've been talking about, taking all these strong measures, you know, could represent the next curve. You know, here where you can see it, it still goes up fairly rapidly, but because we're taking measures, it kind of levels out. It plateaus and it gets level, and it doesn't quite reach, or it just barely reaches that green line where we are still able to cope with the amount of people being sick. We're still able to function as a community. The healthcare system can provide the care it needs to the people who need the care. And then as time goes on, that curve starts to go down. And once it gets below that curve, again, it's something that we can manage until we get through the end of the day, when all the people who are going to get sick, it passes, and then we get back onto, you know, a normal way of life once again. So those three different examples on there, I just try to make a quick illustration, because some people were asking, they weren't sure what we meant by flattening the curve, and that's what we mean, and that's why it's important to take these measures, to spread that out as much as we possibly can, to ensure our essential services can operate, ensure the healthcare systems can provide services to those who are sick. And I certainly hope that helped explain a little bit, you know, from my perspective, you know, on how this and how and why we're doing this within the community, and really the seriousness of the actions being taken. So with that, I hope I put a little more information out there for you to digest, and we'll be back tomorrow with some further updates on the latest developments in and around Kahnawake. So, Nyawagewa.
All right, now Lloyd, and I can assure you the microphone's battery is what died, because Lloyd is like the Energizer bunny. He just keeps going, I'll tell you. Lots of energy. Way to go, Lloyd. Nice job, too, to our technical team this afternoon, because many people need to actually visualize things to get a better understanding, and hopefully that was a help. We'd like to thank all the people who took part in today's update, and just want to once again come back to the Kahnawake Economic Relief Measures Fund Client-Based Services press release that went out today. So if you'd like to take a look at it, you can do so at the Dewduni Zakta website, and of course at kahnawake.com. There's a copy of it there, and if you'd like to get in touch with all the contact information is there, but one thing that's not there is that business persons who want to talk to someone directly, Ietsenhaienhs Frankie McCumber is available, and you can call him if you're a business owner at 438-830-5855. 438-838-5049. And once again, I'll do that, 438-830-5049. If you can't pause your viewing of this, you can call the office tomorrow and we'll get that number to you. And that's about it. Once again, if you have questions, medical questions, don't forget Dr. Gauthier will be here on Friday, and she'll be responding if you send your queries to questions@mck.ca. She will be here on Friday. Make sure they're not of your personal cases, but general questions about COVID-19. And I guess that's about it for today. And we'd like to thank you all for joining us. Hopefully today was very helpful. And stay safe. We'll see you tomorrow. Kahnawake.